One of my favorite awake procedures is injectable rhinoplasty. It's also called a non-surgical nose job, although I prefer to call it injectable rhinoplasty. And this is a way of not making a nose smaller, but actually, unfortunately, making a nose bigger. So only certain patients are candidates for it. And what we do is we essentially eliminate bumps and irregularities of the profile by strategically injecting filler, for example, above and below a dorsal hump. And this patient wanted a more projected tip. She wanted the hump in the middle of her nose to go away, and frankly, she had a kind of small nose to begin with, and so she can afford a little bit of volume. So injectable rhinoplasty is an augmentation procedure in the sense that you walk away with a bigger nose by definition. So if you have a small nose to begin with irregularities in shape, you are the perfect candidate. This goes for many Asian patients who wish to have better definition of their nose, Latina patients, and other patients who have, smallish noses and a desire for improved, if not perfect, profile shape. I enjoy doing it. It's instantly gratifying. It's relatively safe, and it is relatively pain-free. I hope you guys consider this procedure if you want to try on a rhinoplasty for size, as we perform this procedure multiple times a week.